Placenta previa refers to a placenta that overlies or is very close to the internal cervical os. Traditionally, placenta previa is classified when the placenta covers the cervical opening.
This is a normal, healthy placenta. It facilitates vital exchange between mother and fetus. Nutrients and oxygen pass through this intricate vascular network, providing perfect support for development.
Low-lying placenta. Marginal placenta. Partial placenta previa. Complete placenta previa.
Important risk factors include previous placenta previa section or uterine surgery, increasing maternal age, multiparity, multiple gestation, and IVF.
Can you hear me? Take deep breaths. Let's get her vitals and start 2 large bore IVs.
Sending bloods for group, crossmatch, and CBC.
Fluids are going in. Let's put on the CTG.
Do you know the difference? In placenta previa, the placenta covers the cervix. But in placenta abruption, it prematurely separates from the uterus. Know the symptoms of placenta abruption. Watch for bleeding and severe pain. Something is wrong. We need to go now. These are the risk factors of placenta abruption: chronic hypertension, abdominal trauma, smoking or cocaine use, and a previous abruption. In a typical pregnancy, a fertilized egg travels to the uterus. It implants elsewhere. Most commonly, this occurs within a fallopian tube. This condition requires immediate medical attention. After birth, the uterus must contract to stop bleeding. If it relaxes, heavy bleeding called hemorrhage occurs. Management requires swift physical and medical intervention. Development begins at fertilization. By the 4th week, the tiny heart begins to beat. At 12 weeks, limbs and fingers are fully formed. Growth continues rapidly. A fully formed baby. Shoulder dystocia occurs when the head is delivered, but the anterior shoulder becomes stuck. Maneuvers like McRoberts are used, applying pressure to release the shoulder.
It occurs when amniotic fluid enters the maternal bloodstream. Traveling to the lungs, it causes a physical blockage, leading to heart and lung failure.
Today we are discussing placenta previa. Notice how the placenta implants over the cervix? This dynamic shifts significantly in a complete previa. Are there any initial questions? During pregnancy, the placenta typically attaches to the upper part of the uterus. In placenta previa, it attaches lower, covering the cervix. This can cause bleeding during pregnancy or labor. In a typical pregnancy, a fertilized egg travels to the uterus. But in a tubal pregnancy, it grows in the fallopian tube. This is a medical emergency that requires immediate care. The menstrual cycle prepares the body for pregnancy. An egg is released from the ovary. The uterine lining thickens with nutrients. If no fertilization occurs, this lining sheds as a period. Following ovulation, the empty follicle transforms. It becomes the corpus luteum, releasing progesterone. This prepares the uterine lining for a potential pregnancy. Every month, a mature follicle ruptures, releasing a single egg cell, swept into the fallopian tube. During the follicular phase, follicle-stimulating hormone is released, causing several follicles to grow until one dominant egg matures. Day 1 marks the start of your menstrual phase. Here, the lining gently sheds. Estrogen and progesterone levels are at their lowest. Be kind to your body. This is a time for gentle renewal.